A new study reports that says that coronavirus could kill 150,000 people in Africa in a year unless urgent action is taken. A new World Health Organization modeling study that says that nearly 250 million people will be infected. According to the Center for Disease Control on the continent, cases are well over 70,000, whilst the death toll is fast approaching 3,000. Recoveries are approaching 26,000. North Africa continues to be the hardest hit of the 5 geographic regions in terms of the number of cases, with close to 25,000 recorded. And this is followed by West Africa, close to 22,500 there, and Southern Africa slightly above 13,000. East Africa, meanwhile, is just above 7,000, and Central Africa is edging towards 7,000 infections. Well, for an overview of what's happening on the continent, we are now joined by Dr. Mary Stevens, who's a technical officer at the World Health Organization's Regional Office for Africa. Dr. Stevens, thanks very much indeed for joining us. Always good to talk to you. These figures,
Thank you for having me.
Yeah, these figures, 150,000 people in Africa could be killed by this virus just in 1 year.
Yes, so this prediction is based on whether the containment measures fail. But luckily enough, we are not at that level yet in Africa. Countries' effort is slowing down the progression of the virus. So basically, the model is looking at a situation where these containment measures being implemented by Africans failed. But we are not at that stage yet. We are seeing the measures being implemented, slowing down the progression of the outbreak on the continent. As you can see, Africa is by far reporting the least number of cases if you look at what is happening globally, and what we would like to call on government to ensure that these measures are sustained, and where we need to ramp them up, we continue to ramp them up so that we don't get to this stage where the predictions will come to pass. But right now we are in a better situation, and we hope that measures can be sustained by countries.
You say we're in a better situation, and that's based on our reporting, but are you confident about the reporting itself that actually is reflective of the situation on the ground? There are some people who are saying that they can't believe that Lesotho's only got 1 case. We know that there's some countries like Burundi, Tanzania even, that are questioning the way that things are being handled. We've got a president who's fired the head of, who's in charge of testing in the country. With these kinds of things, can you be sure that the figures that are being reported reflect the situation on the ground?
Yeah, for the figures in Africa, we have different situations happening across all the nations in Africa. Yes, we understand that there are challenges in some of these countries, and reporting might be limited, but we believe that the figures being reported currently by majority of the countries in Africa is a reflective of the situation that is happening. But in addition, we also have the testing strategies that the countries do have. So for countries that are doing community testing, we expect that they will pick more cases than countries that are doing testing of suspected cases and their contacts. But still, it's still a good reflection of what is happening, knowing fully well that we have some pockets of few countries where there are challenges with reporting.
What have we been able to do well then? If I look at Europe, if I look at North America and Asia, what is it that Africa has done well to not see the kind of first wave that these other parts of the world have?
Yes, so since the outbreak started in China, countries in Africa, even before the region started reporting cases, they have been enhancing their readiness capacity for a potential importation of COVID-19. So there were a lot of activities happening and interventions. And following the report of the first case on the continent, which was on February 14 in Egypt, the region moved to response mode, and they have been implementing in most countries aggressive public health measures, the surveillance measures. We've been discussing about expanding this surveillance to community surveillance and house-to-house case search, which is being implemented even right down in South Africa where you are. Quite a number of countries are doing that to make sure that they pick as much cases as possible. The issue of testing, the countries were able to ramp up their ability to do testing in country. We started with testing of just suspected cases, and then countries began to expand this testing based on their testing strategy. So now quite a number of countries are doing community testing, and the others are not doing community testing, are doing testing of contacts, and they are doing testing of people in quarantine before they release them out. And the issue of isolation, prompt isolation, any case that is confirmed is promptly isolated and managed in the designated facility. So most countries in Africa have been implementing this, with coupled with the contact tracing as well. So monitoring the contacts on daily basis and picking all the potential cases. Any contact that presents with potential COVID is tested already and isolated, and the contacts of that person being followed up for 14 days. In addition to that, the community has been implementing the different preventive measures being recommended by governments. And we move from closure of our borders to implementing lockdowns, which has shown to also slow down the progression of these outbreaks. So basically limiting this movement of people, reducing the number of people that are exposed to COVID-19, and of course, reducing the infection rate. So the public health measures that are being implemented in Africa has shown to be working, and it has really contributed to slowing down the progression of the outbreak. Despite the challenges we have on the continent, we have seen that the cases has not happen as predicted. So we are seeing much more lower cases, and we call on countries in Africa to continue to ramp up these measures so that we can break every chain of transmission, even in countries with community transmission, to curb further spread of the outbreak.
All right, so you said ramp up measures, but we're starting to see an easing down of lockdowns in these various countries. Is there not a fear that we're going to start to see a spike in the infection rates as a result of the easing of these lockdowns?
Yes, it is a possibility if we don't carefully ease this lockdown in phases. If we remove them just abruptly, there is every chances that we can see spiking of these cases, because we know what the lockdown does. It reduces the number of people exposed to this virus, and it ultimately reduces the number of people that will get infected, and with that you are able to break the chain of transmission. But when these measures are lifted quickly, the chances of having a resurgence is there. We are seeing globally, if you look at the picture, some of the countries are beginning to see that. So we call on Africa to ensure that this easing of lockdown is done in phases, so that we don't lose the gains we have already achieved. I remember we had a discussion last week or 2 weeks ago on this same channel, talking about the gains that we have already made. We have made the sacrifice to stay at home. So let's not risk the reversal of this gain, but continue to build on the gain. So meaning that we have to test the waters. So you don't just put yourself wholly into the water, just put your leg first and see if there are any changes, then you can retract back.
Yeah.
So just doing it in phases, testing how it is working while we continue to implement the public health measures so that we don't lose the gains we have already made. The continent has done a very good job in terms of curbing further spread of this outbreak, and we need to continue.
All right, so where do you see the biggest risk in terms of perhaps these containment measures failing? Because at some point there might be weak spots, and where do you see those Achilles heels across the continent?
Yes, so the containment measures, the public health measures, we know. Let's look at it again. The issue of surveillance and early detection of cases, testing and isolation of these cases, then tracking of all the contacts. So where we could have challenges, especially if we allow people to interact freely, would be a situation where you have large number of people being exposed to the virus again, and then increasing number of cases. And once you have very, very widespread community transmission like you find in Italy and Spain, then it becomes much more challenging to handle. So you will need additional or extra resources in terms of human resources, financial resources, the effort you need to put to cope this further spread, and the time that you will need. It will need a lot more effort than what potentially we have, and possibly, the system in Africa is not strong, so we could risk the potential of overwhelming the already stretched system we have on the continent, which could be a problem, and having some additional consequence in terms of management of other health conditions on the continent, HIV/AIDS, TB, malaria, things that we can easily treat, could suffer in the process when all our hospitals are full with COVID cases. So that is the reason why it is essential to continue to implement these measures, and together with the restrictions, the physical distancing measures and the restrictions, to avoid exposure of additional people to this outbreak, so that we can limit further spread of this outbreak, and of course have a very good chance of early breaking of chain of transmission and containment of the outbreak.
All right, there's some transmission hotspots across the continent, and will it be much like they're doing in the United States now, where they're saying that those transmission hotspots, they will remain locked down a bit more as you ease other parts of the state? Are we going to see the same in Africa, do you think, where the areas that have got the highest concentrations at this stage to stay locked down whilst others open up their economies?
It's a possibility. Even from the beginning of implementation of lockdown on the continent, some countries did not implement nationwide lockdown, pretty much because of the kind of transmission pattern they have. Some of them have fewer cases than other countries, so they implemented this lockdown majorly in those affected areas, and there was movement in other areas. So going forward, yes, it's possible to focus on those areas of transmission, hotspots, and then extend further the movement restriction, and then open up some of those areas where you have fewer cases. But yet we still have to do it with caution, so that we don't lose the gains already made. But it's a good approach, and it can be done even in the African continent. So we can do that too.
All right, Dr. Stevens, always a pleasure talking to you. Thank you so much indeed for giving us these insights that you have about the situation on the continent. And let's hope that we continue to ramp up these containment measures and make sure that we don't see the kind of spreads that have happened in other parts of the world. But thanks so much for your insights as always.
Thank you for having me.
All right, that's Dr. Mary Stevens, Technical Officer at the World Health Organization's Regional Office for Africa.